The Uganda Non-Communicable Disease Alliance has engaged a district COVID-19 task force in Luuka to pave a way of supporting people living with NCDs during the COVID-19 pandemic. Julius Mohumuza has more to this report.
District-based dialogues have been conducted in Luuka district to pave way of improving NCDs services in the era of COVID-19 pandemic. In attendance was the RDC Luuka Chief Administrative Officer, District Chairperson and Health Facilities in charge. Christopher Kwizera, the Executive Director, Uganda Non-Communicable Diseases Alliance, team leader of the dialogue, revealed that they want to make the people living with NCDs get involved in planning and implementation of COVID-19 responses.
COVID-19 affects mostly people living with NCDs, and there's no way we can enforce the dialogue, and there is no we can have them involved until we meet the district leaders. Right from the community, we meet the communities and get their voices. We go to the health facilities, we get the voices of people living with NCDs in relation to the services at health facilities. The same voices are brought to the district level, and we speak with district leaders. We give them the feedback from the people, and after we've had the meeting with the district, we discuss the views of the people living with NCDs and their recommendations.
Rosemary Byabashaija, RDC Luuka, during the dialogue said she would spearhead the sensitization campaign on NCDs to ensure that people go for screening services.
We want to sensitize people on lifestyle. We want to sensitize people how to manage. If somebody is diabetic, how he or she should manage himself. Then high blood pressure, to do exercises. Anyway, we shall embark on sensitization to ensure that our people come for testing, for screening. Let them come and screen, because people don't know that they're supposed to screen.
Byabashaija and other district leaders who attended the dialogue vowed to advocate for more drugs for the non-communicable diseases in the district.
Sensitization is very, very, very paramount. But also, we shall advocate to see that we get drugs at health facilities in a timely manner. For example, we have some drugs for high blood pressure, we have drugs for diabetes, but they're not enough.
Next month, that's December, we are going to do a procurement planning meeting. So I'd like to thank every intern who is in this house, most especially those where the clinics are, to be in that procurement planning meeting, so that will increase the medicine we want.
Luuka District Health Officer Wandira Christopher clarified on the issue of giving people living with NCDs a priority to be vaccinated in the different health facilities.
And it is still, now we have opened up, but the focus was telling us, look at the people who are above the age of 50, people who have comorbidities, and the key comorbidities were NCDs, and focusing on that, when we opened up vaccination, we were targeting people with the NCDs. But as you say, we didn't have a special focus like maybe how to mobilize people with NCDs, but the message was all over.
The story was filed by Julius Mohumuza for GMTV News.